Good day, everyone. Today we're diving into experiments 11 and 12, which focus on the chemical examination of urine. This is an essential MLS skill because urinalysis is one of the most frequently requested diagnostic tests in clinical practice. We'll walk through both normal and abnormal urine constituents, their clinical significance, and the qualitative tests used to detect them. In this experiment, you should be able to first is to differentiate normal from abnormal urine based on both appearance and chemical composition. Second is to identify chemical substances found in each urine sample, whether they should be present or not. And lastly, correlate the chemical findings with clinical conditions because as future medical laboratory scientists, you need to understand not just the what but also the why behind every result. So here's a quick refresher on how urine is formed. The kidneys filter around 180 liters of plasma per day, but only 1.2 to 1.5 liters actually become urine. This means the rest is reabsorbed, a sign of how efficient the kidneys are. Urine exits the body through urination, passing from the kidneys to the ureters to the bladder and to the urethra. Understanding this physiology helps you connect abnormal urine findings to specific kidney functions. Now let's talk about the renal system. The renal system is a system which is composed of two kidneys, two ureters, one bladder, and one urethra. As the components of the renal system, the kidneys have the following functions. So first is regulation of water and electrolyte, such as chloride, potassium, calcium, hydrogen, magnesium, and phosphate ions. So they regulate the water and electrolyte balances. So as well as regulation of acid-base balance of the blood. Next, our renal system, or specifically the kidneys, regulate body fluid osmolality and electrolyte concentrations. They regulate arterial pressure, excretion of metabolic waste products and foreign chemicals. The kidneys are the primary means for the eliminating waste products of body metabolism that are no longer needed by the body. So these products include urea from the metabolism of amino acids, uric acid from the nucleic acids, creatinine from muscle creatine, bilirubin from the breakdown of hemoglobin, secretion of hormones such as renin, gluconeogenesis. The kidney synthesize glucose from amino acids and other precursors like lactate and glycerol during prolonged fasting by the process called gluconeogenesis. So the physiology of the kidney and the formation of urine. So the kidney is a highly discriminating organ which maintains the internal environment by selectively excreting or retaining various substances according to specific body needs. Approximately 1,200 milliliters, as what I have said earlier, or 1.2 liters of blood flow through the kidneys each minute. So this represents about 1/4 of the total blood volume. Then the blood enters the glomerulus of each nephron by passing through the afferent arteriole into the glomerular capillaries. Afferent arterioles will bring blood into your kidney's glomerulus. Glomerulus are blood vessels that filter your blood. So afferent arterioles can dilate or get wider to allow for more filtration. While efferent arterioles, on the other hand, will take blood out of your glomerulus. Arterioles in your lungs constrict or tighten when there's not enough oxygen. After that, the capillary walls in the glomerulus are highly permeable to water and the low molecular weight components of the plasma. They filter through the capillary walls and the closely adhering membrane of the Bowman's capsule into the Bowman's space, from where the plasma ultrafiltrate passes into the tubule, where reabsorption of some substances, secretion of others, and the concentration of urine occur. So many components of the plasma filtrate such as glucose, water, and amino acids are partially or completely reabsorbed by the capillaries surrounding the proximal tubules. In the distal tubule, more water is reabsorbed and potassium and hydrogen ions are secreted. The loop of Henle and the system of collecting tubules are the principal sites where the urine is concentrated as a mechanism for conserving body water. Urine formed by the three physiological processes that are by glomerular filtration, tubular reabsorption, and tubular secretion is collected by the collecting duct and passes into the bladder through ureters and then comes out through the urethra. So that's the formation or the production of your urine. Now let's proceed to urinalysis. It is a general health evaluation and often the first test physicians use because it's simple, inexpensive, and non-invasive. But take note, it's a preliminary test and not confirmatory. So a complete urinalysis has three components. First is the physical properties such as your color, clarity, odor, etc. The second one are the chemical properties using dipsticks or chemical tests in order to identify the presence of those chemicals. And lastly, biomicroscopic findings. So we are going to find or look under the microscope for cells, casts, and as well as crystals. So urinalysis also serves as a tool for monitoring kidney diseases and even screening for substance abuse. Let's talk about the physical properties of the urine. We have the color. Color is one of the first things we look at. Normal urine ranges from pale yellow to amber, depending on dehydration and urochrome concentration of the patient. So darker urine, it means that the patient is possibly dehydrated or it means dehydration. Red or pink urine, usually there is the presence of blood or there is beet ingestion or medications. Other unusual colors may indicate metabolic disorders or drug effects. So remember, color alone is never diagnostic, but it provides important clues. Now let's proceed to the pH. Urine pH normally ranges from 4.5 to 8.0, with the average being around 6.0 to 6.5. Low pH or acidic pH may indicate diabetic acidosis, which will have increased ketone bodies, starvation or fasting, which is due to fat metabolism, and then high protein diet due to sulfuric acid production. And then high pH or alkaline pH may suggest UTI due to the high production of your urease producing bacteria. We also have renal tubular acidosis. Your kidneys fail to excrete acids. And then vomiting or gastric suction. There is a loss of gastric acid in your stomach. And then high fruits or vegetable diet, which means that you are consuming high potassium and magnesium intake via the food that you are consuming. So please take note that pH helps us connect chemical findings with metabolic or infectious states. Now let's proceed to the normal constituents of the urine. So the normal ranges, it really depends on the diet for muscle mass, and then kidney health, hydration status, and the completeness of the urine collection. Now let's proceed first to the calcium in urine. Calcium appears in urine because it's part of the body's mineral regulation. So the normal values, it will range from 100 to 300 milligrams per day or 50 to 150 milligrams per day on a low calcium diet. So excess calcium can lead to calcium phosphate kidney stones, especially when urine pH is high. So testing relies on precipitation using potassium oxalate, forming calcium oxalate crystals, which you may also observe microscopically if you're going to observe it under the microscope. So for the reagent used in calcium, you can use 2% potassium oxalate solution, which is a precipitating agent. So the positive result, you will have a white precipitate which remains insoluble. Next, we have magnesium. Magnesium is essential for enzyme function and neuromuscular activity. So the body excretes any excess through urine. So the normal levels would range from 24 to 120 milligrams per day. For analysis, ammonium hydroxide is used to precipitate magnesium as magnesium hydroxide. So low or high levels can relate to metabolic status or kidney function. So the reagent used for your calcium, we have your 10% ammonium hydroxide. So next we have your chloride, sulfate, and phosphate in the urine. So these are normal inorganic constituents. So chlorides, they reflect sodium intake. So usually the normal value or the normal reference range would vary from 110 to 250 milli equivalents per day. And then sulfates, these are the end product of sulfur containing amino acids. Their normal reference range is 0.04 to 0.1 gram per day. And lastly, phosphates, this is related to diet, ATP, and bone metabolism. Normal reference range would range from 0.5 to 1 gram per day. So these levels may vary with diet, metabolism, and as well as the renal health of your patient. So testing involves precipitation reaction. So for chloride, if you're going to add silver nitrate, it will result into silver chloride, which will result into a white precipitate. So the same with sulfate, if you're going to add 10% barium chloride, then it will result into a barium sulfate, which is also a white precipitate. And then lastly, for phosphate, if you're going to add ammonium molybdate, it detects phosphate by a complex formation. So these tests are straightforward and rely on visible precipitates. Next, we have your organic compounds. So organic components include urea, creatinine. So for urea, 12 to 20 grams per day. This is a major nitrogen waste. So this is affected by diet and as well as the hydration status of the patient. For creatinine, it varies by muscle mass. So for males, 0.8 to 1.8 grams per day, while the females, on the other hand, will have 0.6 to 1.6 grams per day. We also have others such as uric acid, amino acids, uric acid, urobilinogen, vitamins, hormone metabolites, etc. So knowing the normal baseline helps us detect abnormalities later. So there are also other interfering factors that result in abnormal urine color formation, which are certain foodstuff and medications. So foodstuff such as beets will give white red color of your urine. Drugs such as vitamin B12 and riboflavin will give bright yellow color to urine. Rifampicillin will give red color to urine. Iron salt will give dark color to urine, and sulfonamides will give rusty yellow or brownish color of your urine. Now let's proceed to the abnormal constituents with conditions. So these indicate pathology. For protein, it indicates proteinuria, meaning there is a glomerular damage in your kidneys. For the glucose, glycosuria, which could be related to diabetes. Ketone bodies, starvation, fever, and as well as diabetes. For bilirubin, liver damage or obstruction, and presence of blood, it could mean infection or trauma. So these findings are clinically significant and often require confirmatory testing. So urine composition changes with diet and nutritional status, metabolic conditions, kidney function, contamination such as your bacteria or the microflora. When we talk about microflora, these are the normal microorganisms or bacteria that is residing within us. So, so these factors reminds you to consider both pre-analytical factors and as well as patient history when interpreting results. Now let's proceed to the different chemical tests. First, we have your biuret test. The biuret test detects peptide bonds, so making it a general protein test. So the reagents used, you have your potassium hydroxide, you have your copper sulfate, you have your potassium sodium tartrate. So for the positive result, you will have a violet solution. So this happens because copper ions form complexes with nitrogen atoms in peptide bonds. So let's just have a quick recap about proteins. So protein is a macromolecular composed of one or more polypeptide chains, each possessing a characteristic amino acid sequence and molecular weight. So it has many biological important functions. So some of the functions are acting as enzymes, such as your trypsin, transport proteins such as your hemoglobin or myoglobin, nutrient and storage proteins such as your ovalbumin, which is found in your egg, and then casein, which is found in the milk, and then contractile or motile proteins such as our actin and myosin. Structural protein, we have your keratin, fibroin, and your collagen. Defense protein, we have your antibodies or fibrinogen. And regulatory protein, we have your insulin, we have your growth hormone. So those are the different functions of our proteins in our daily lives. So test for urinary protein is one of the most important and valuable parts of the routine urinalysis. Albumin is one of the important proteins which appears in the urine during a pathological condition. It often occurs as a symptom of renal disease, so globulins are excreted less frequently. Benz-Jones protein, it is a specific type of globulin excreted in patients having multiple myeloma. Next, we have the Heller's ring test or the Heller rings test. So Heller's test detects proteins using concentrated nitric acid, which will denature the proteins. So positive result, you will have a white ring at the acid-urine interface. And then this is a classic test for proteinuria but must be handled carefully due to strong acids. So let me give you a brief principle of the Heller's test. So this test is based on the principle of precipitation of your proteins, which in this case takes place in the presence of mineral acids like nitric acid. So protein precipitation by acids relies on the changes in the pH of the solution. As all proteins have a defined isoelectric point or the Pi value, changes in the pH of the solution affect the structure of the protein. So the addition of acids to a solution reduces its pH value. So as the value decreases, protein molecules become positively charged due to the proton capture by amino acids or the amino groups present in the proteins. So in an aqueous state, the hydration sphere that surrounds the protein becomes disrupted due to the charges. So the disruption brings about an imbalance in the structure of the protein, resulting in precipitation. So the addition of your acid to a protein sample causes precipitation of proteins at the point where the acid comes in contact with the protein solution. So as a result, A white coagulated ring is formed between the two layers of protein solution and the mineral acid. So the uses of Heller's test. So Heller's test is a biological test used for the detection of proteins in biological fluids. So the test is better than the other similar tests as the test requires a small amount of urine sample. So let me just give you also a background about the causes of proteinuria, meaning the presence of proteins in the urine. So first, we have your increased permeability of the glomerulus. Second is a decrease in normal reabsorption in the tubules. So Heller's test is not suitable for routine analysis of proteinuria because of the highly corrosive nature of the concentrated nitric acid. Next, we have the Benedict's test. This test detects reducing sugars, mainly glucose. So the reagents used copper sulfate, sodium carbonate, and as well as sodium citrate. Positive results are precipitates ranging from green to red, depending on glucose concentration. For the green, it indicates low concentration of glucose, while the red, it indicates high concentration of glucose. So this correlates with glycosuria, which is common in diabetes. So determination of the urinary sugar, specifically glucose. Let me just give you a quick again recap of what glucose is. Glucose is a monosaccharide. It is the principal sugar in our blood. It serves the tissues as a major metabolic fuel. So it is mainly the end product of carbohydrate digestion, which provides energy for life process. So when the sugar appears in the urine, so it shows the abnormality caused by disease diabetes mellitus. Hence, urine sugar tests are extremely useful in monitoring the treatment of diabetes. So Benedict's test is a very sensitive copper reduction test and may give positive reactions with non-specific non-glucose reducing substances which are normally present in the urine. So since glucose is the reducing agent, it is oxidized to gluconic acid. The positive reaction is indicated by a color change as presented in the presentation, or it is already flashed in the screen. So it is a qualitative test in which the degree of color formation is proportional to the amount of reducing substance present in the sample. So when boiled in an alkaline copper sulfate solution, your glucose and other reducing substances reduce or convert the blue copper in Benedict's qualitative reagent to copper oxide, so which is orange to red in color. A positive reaction is graded as a change in color ranging from blue to green, yellow, orange, and finally red. So the copper ions are supplied in Benedict's qualitative reagent in the form of copper sulfate. So in the presence of a strong alkali, this is converted to copper oxide. So the heat is supplied by means of a boiling water, usually 100 degrees Celsius in a water bath. So the tubes are brought back to room temperature and the results are read when convenient. Next, we have your nitroproside test. So this test detects ketone bodies, particularly acetoacetate and acetone. So the reagents, you have sodium nitroproside and acetic acid and your ammonium hydroxide. So positive test or positive result, you have a purple ring. Please take note that it does not detect beta hydroxybutyrate, which is also a form of your ketone bodies, in which beta hydroxybutyrate is elevated in diabetic ketoacidosis. So let me just give you a quick background about ketone bodies. So ketone bodies, or also called as ketones, are a group of three related substances such as acetone, acetoacetate, or other name of acetoacetate, you have acetoacetic acid or diacetic acid, and beta hydroxybutyrate or the so-called beta hydroxybutyric acid. So ketone bodies are normal products of our fat metabolism. They are normally not detectable in the blood or urine, but in normal metabolism, fat is broken down in the tissues to glycerol and fatty acids. So the free fatty acids are transported by the plasma albumin to the liver, where they are broken down to acetyl coenzyme A or the acetyl CoA molecules. So these condense with oxaloacetate in the Krebs cycle to produce citrate. So the citrate is then oxidized to produce heat and energy. Whenever there is inadequate carbohydrate in the diet or a defect in carbohydrate metabolism or absorption, the body metabolizes increasing amounts of fatty acids, which is then converted into excessive amount of acetyl-CoA. The extra acetyl-CoA molecules join up in pairs to form acetoacetic acid. Most of this is reduced to beta hydroxybutyric acid while some is decarboxylated to acetone. Acetoacetic and beta hydroxybutyric acids are transported in the blood to the peripheral tissues to serve as an alternative fuel for cells. So in the peripheral tissues, these ketone bodies are reconverted to acetyl-CoA and oxidized by the tricarboxylic acid to give energy. And then acetone is excreted in the urine. So ketone bodies can be seen also in the urine during prolonged vomiting, severe diarrhea, anesthesia, severe liver damage, high fat intake, and low carbohydrate diet. So the excessive production and accumulation of your ketone bodies may lead to ketosis. So its physiological effect is serious because acetoacetic acid and beta hydroxybutyric acid contribute excess hydrogen ions to the blood, which will result in acidosis. So acidosis is a condition that tends to lower the blood pH. So if not corrected in time, this may result in death. So another physiological effect of ketone accumulation concerns the substances acetone and acetoacetic acid, because both have been found to be toxic to brain tissue when present in increased amounts in the blood. So this condition can result in permanent brain damage. Now we have your Gemeline's test or the Mellins test. So this will detect bilirubin using concentrated nitric acid. So the positive result, you will have multicolored rings, which could range from green, blue, yellow, or red. And the presence of bilirubin, it will indicate bilirubinuria. So this is often due to liver disease or bile duct obstruction. Next, we have your Pettenkofer's test. So this test will detect bile salts. The reagents you will use sucrose plus concentrated sulfuric acid. Positive result, red ring because sucrose reacts with cholic acid to form furfural derivatives. So it complements with your Gmellin's test or the Mellin's test. And lastly, we have your benzidine test. So this test detects blood in the urine, so such as hematuria or hemoglobinuria. Reagents, you have benzidine, glacial acetic acid, and as well as hydrogen peroxide. So positive result, blue or blue-green color. So this happens due to oxidation of your benzidine by hydrogen peroxide in the presence of heme. So let me just give you a quick background about the hemoglobin. Hemoglobin is a respiratory pigment in the red blood cells composed of an iron-containing group or the so-called heme and a complex protein which is also known as your globin. So in combination, as hemoglobin, it has the property of forming a reversible combination with oxygen. So it serves as a transporter of oxygen in the blood from the lung to metabolically active tissues. So it also transports carbon dioxide and hydrogen ions to the lung from metabolically active tissues. So hemoglobin appears in the urine when there is extensive or rapid destruction of your circulating erythrocytes, or there is hemolysis, so that the reticuloendothelial system cannot metabolize or store the excessive amounts of the free hemoglobin. So this slides show sample outcomes from actual student experiments. So I have just an important reminder to each one of you. So the results will really vary depending on the individual's urine composition. So always compare visual results carefully with the expected reactions. So as we wrap up today's journey through urinalysis, I want you to remember one thing. So this simple yellow fluid holds some of the most powerful clues about human health. So from proteins to pigments, from sugars to stones, each chemical reaction you saw today isn't just a laboratory step. It's a story about what the body is trying to tell us. So, as future medical laboratory scientists, you are the translators of these silent messages. Your skill, precision, and clinical judgment can guide diagnosis, change treatments, and ultimately save lives. So, keep your curiosity sharp, your techniques accurate, and your passion for learning alive. So, because in the world of clinical science, even the smallest drop can make the biggest difference. So, thank you, and may your future results always be clear, accurate, and clinically significant. So, see you all soon, everyone, and good luck, God bless, and Bismillah.